blasting machine called a lithotripter, which can break it up, or they actually have to go up from below and extract it. The other old-fashioned way, which we still sometimes do, believe it or not, is to cut in through your back and actually go into your kidney. None of these are all that pleasant. So, you know, when you're stuck and this is an emergency, it becomes a pretty big deal. And I mean, we'd sometimes have, you know, 10, 11 stone cases a day. So it's pretty prevalent. If you haven't experienced it a lot in your community, you probably will at some point either have a relative or a friend who has a pretty horrible bout. And the reason they're kind of so terrible is there's not a lot of warning. Most people say they'll be out doing their normal activities and almost drop over with pain. You know, start nausea, vomiting, just uncontrollable 10 out of 10 pain. You know, people have almost driven their cars off the road. And what it really is it's small deposits of mineral and acid salts on the inside of the kidneys, because your kidneys are kind of these curved structures inside that are essentially hollow. And because of the main filtration system for all the urine, it's thought that when things are too concentrated or there's too many heavy solids, all the crystals precipitate out and they accumulate in these little crevices and form stones. Problem is, you can have some up there that are non-obstructing for some time, for years even, not cause a problem. But when one goes on the move and actually hits the ureter, even a stone that's about the size of a millimeter can cause significant discomfort. We've even had to do surgery for a stone the size of a millimeter that got obstructed. So something that can be centimeters or something that can be as tiny as a millimeter can be an emergency situation for people. They're kind of classified depending on the location. Like I said, in the kidney, they can be fairly silent. Some of the larger ones tend to rumble around. People get occasional pain or bleeding, but typically they're not that bothersome. It's when they lodge into the ureter. And, you know, depending on how fast they move, people ask all the time, you know, how many days is it going to take me to pass this? You don't know. Some people it's weeks, some people it's a matter of hours, but it has to make it all the way down the top and through the little opening into the bladder. Generally, if it makes it to the bladder, you're going to pee it out just fine. Although most people are pretty scared about the idea of something that's a rock coming out through their urethra, it actually is much larger and much wider in diameter than the ureter. So normally people are fairly pain-free by the time it does make it all the way down to the bladder. The types are mainly calcium oxalate, which is the majority, probably about 80%. They're not sure why. There are some metabolic reasons we'll discuss. Uric acid stones, which can be tricky because they are not always visible and difficult to see. Sometimes they actually dissolve. So somebody will have all the symptoms and actually really not produce any real crystals because it's dissolved. Struvite, which are kind of associated with infections and UTIs and people who are having bladder drainage issues in general. And calcium phosphate's another one. And so this is just a brief sort of smattering. They're generally always measured in millimeters, as you can see on here. That one looks like it's been broken up by one of those lithotripter machines. But in general, that's how they kind of like to classify these. They come in all sizes and shapes. They can be smooth, like little river pebbles, or they can be huge stalactites and jagged and sharp. And that's part of the reason why they're so painful, is they essentially just shear their way all the way down the ureter as they're coming out. So they can be any shape or color. Sometimes they're black, sometimes they're white, sometimes they're yellow. There's no rhyme or reason to it.
What's the largest size that can pass through a ureter?
It depends. I've seen them as large as like 1.5 centimeters that's past their ureter. Yeah. So it was a pregnant lady that came in, and we couldn't really get good imaging on her because you could only do ultrasound. And then she finally had the baby. We imaged it, and she had a stone that was about the size of an acorn. She actually had the lithotripsy procedure, but it only knocked off a brief corner of it, and she actually passed the whole rest of the stone. So she called in saying she couldn't pee for a while, and that's what it was. She had to plunk that out. And so she brought it in all intact in one piece to the clinic.
Wow.
So here's kind of the key anatomy which they give you. These are mainly where the stones form, and you can see them in the upper poles or the lower poles. They're all hollow in here. This is generally where they're asymptomatic. As soon as they reach the neck of the ureter there, that's where they become increasingly problematic. The reason the anatomy is kind of important here is because when you reach sort of the distal third of the ureter, you start to run into the bones of the pelvis, and that actually, in some cases, can make people not qualify for that blasting, that lithotripsy procedure, because sometimes the shock waves can deflect off of the bones in the pelvis. So a lot of times, if the stone gets really far down, but it's trapped, it won't pass, and we think the ureter's probably engorged or swollen, oftentimes they'll tell you really your only solution is really to go up. That lithotripsy is probably not a good idea, or if so, it's going to have a drastically reduced success rate. So, you know, and then I've seen people, it's been way at the top and it's passed in a matter of hours. I've seen people, it's right at the neck by the bladder, and they've gone weeks and it still hasn't come out. So there's no definitive timeline you can give people, which is once again why it's pretty frustrating. And here's one thing, this is kind of our classic imaging study, because it's called a KUB, kidneys, ureters, and bladder. And here you can see they've just put in some contrast dye to kind of show you, to light up. These are what the hollow crevices of the kidney look like. For some stones too, particularly uric acid stones, they don't show up on plain film x-rays. And so a lot of times we will have to do a study like this in general to inject dye, even if they're doing the blasting procedure, so we can localize it, because sometimes it's moved by the time you actually get to surgery from where it was diagnosed or originally thought to be. And uric acid stones are particularly difficult to deal with because you can't see them on plain x-ray. But this is sort of our go-to study. We have people that come in, we can clearly identify where the stone is and approximate it, and if we think they have a good chance of passing it on their own, generally we'll give them some medication, tell them to push fluids, and repeat an x-ray in a week, see if it's making its way downwards. You know, if it's progressing pretty swiftly, we'll probably just stick to x-rays and see if the person can just pass it on their own. So these are the odds. I think they're higher than this in Whatcom County, but this is what I found, which is why most people know somebody or have had a relative with kidney stones. Most people, and actually some people, pass them all the time. They're just tiny, and they pass what feels like little bits of grit and sand. So they say about 90% pass spontaneously. About 80% are under 2 millimeters. After you hit the 2 millimeter mark, you're really starting to have something that's going to cause an issue. Even if people pass it, usually by the time it's a 3 millimeter stone, you're talking some serious pain, probably an ER visit, depending on the person. And then the odds are, it's no guarantee, but sort of our fast and hard rule is if it's 5 millimeters or below, there's about a 50% chance you'll pass it. Getting up above 5 millimeters, your odds start to drop off. And really, our big cutoff used to be, you know, either if the person's hit the ER 2 or 3 times, or if you've got a stone, say, you know, 7, 8 millimeters, you should probably plan on surgery if it's going to persistently be that problematic.
5 millimeters is just 1 millimeter short of a 1/4 inch. It's huge.
So symptoms are pretty common. You've seen it. These are some of the most intense pain cases I've ever seen. I mean, people vomiting, about to pass out, you know, not even able to get an IV started in the ER. Lots of ER docs will know right away when they see somebody coming in that are just writhing and sweating and, you know, nonverbal almost, that it might be a kidney stone. So you can have anything from flank, abdominal, or pelvic pain. For men, also not uncommon to come in with a chief complaint of testicular pain. Believe it or not, it's sort of odd, but that is somebody otherwise healthy. That should be a little bit of red flag. You can get blood in the urine, you cannot. I've seen people actively passing a stone, urinalysis is negative. It doesn't always indicate. And somebody though who has had a history of stones and you don't know what's going on, that's usually the easiest, cheapest thing to do, is just get a quick urinalysis. You can also get symptoms of urinary frequency. A lot of people come in thinking that they've got a bladder infection. They're having to go all the time. They have that constant urge. That can be classic when the stone starts to get down distal in the ureters, or if it's lodged at the opening to the bladder, it'll irritate your bladder to the point where it will make you pee frequently and have frequent urges. You can get nausea and vomiting. Not everybody does. You can get fevers, chills, and CVA tenderness, which is right up here in the back. And that's a classic one that I tell people to be concerned about. Because kidney stones, if you can manage the pain, you know, and you think people are going to be able to pass it, they can be somewhat benign. But if you get infection behind an impacted stone, and your number one, you know, serious sources of that, or symptoms of that would be fevers, chills, or that upper back pain, really where they almost leap off if you touch them, that person can go septic pretty quick. We've seen cases where people are okay, and within just a few hours they can get really sick. So if you ever think there's a chance that somebody has an impacted, infected stone, It's a good idea to get them evaluated, make sure they do go to the ER or get an imaging study. Positive urinalysis is not always key. Stones coming through kind of really rustle things up. They make you slough a lot of white cells and some other inflammatory markers. A lot of people come in, they think people are really ill. You can have a very dirty looking urinalysis just from passing a stone. So it's not always key, but it's always something to keep in mind, particularly if you think the person's febrile or very ill appearing, that if they get septic, that can be a very serious situation pretty quickly. And it's not one that we just want to wait and see if it can pass. So the diagnostics, I mentioned the plain, just KB and the x-ray, which is really good if you have really no idea. Those are your resources, and you can usually get those right away. People can walk in and Mount Baker Imaging and get them. Our gold standard is an actual just plain non-contrast CT scan. Some people have gotten MRIs for some reasons. Actually, those aren't preferred. Radiologists actually don't even like trying to read those for kidney stones. The way the imaging comes up, it's just not as optimal as a CAT scan. So if you are in doubt, CT is preferred, especially over the expense and the imaging of the MRI. Ultrasound, it's not gold standard because oftentimes I've seen it's really off on the sizes. It can say that something's 2 millimeters, ends up being a centimeter, and vice versa, something that's really small, much larger. That being said, sometimes that's the only thing you have, and it can show whether or not urine is able to enter into the bladder through the ureteral jets. The one case we always have to do it is if somebody's pregnant, because we do not like to get a lot of CAT scans to pregnant women, so we end up having to go with an ultrasound and see what we can do with that. There are some other people who aren't necessarily healthy enough, or that's the only resources they have around, but an ultrasound's not bad either. Once again, we do look at the urinalysis, and physical exam's key. Really, if you've got that upper back pain or really classic groin pain with a history of stones, you have a pretty good idea what's going on.
Back pain in people.
Yeah, they call it
migrates.
the costovertebral angle, and that's really pretty classic. If you whack somebody back there, and you see them pretty much jump. It's not the lower down, like sciatic or lower back pain or anything higher up. It's really pretty specific.
Does that pain migrate as the stone is moving?
It can, or it can just remain constant. I've had some people come up and, even though most of their pain's upper quadrant, the stone's actually by the bladder. It doesn't always correlate, so they can be pretty tricky. Sometimes, you take several x-rays trying to really figure out where it is. So on x-ray, it should look like a big, chalky, white deposit, just like a bone. So lithotripsy, what we were talking about before, is that machine that has modified and advanced over the time that breaks up the stones using ultrasonic shockwave blasting. It's considered, because it's usually non-invasive, most people prefer it. Right now, if you go in and it's a fairly simple stone, they can go in, they do put you to sleep, but it's generally about an hour procedure, almost always outpatient. They position you on a special table, which I'll show you, and they position a C-arm around you so they take a real-time x-ray of the stone and deliver the shock waves. And they can focus in on it with a 3D picture, and then sometimes they even move the machine around or rotate it to keep blasting it up till it, and then literally it looks like somebody stepped on a hard candy. It's pulverized in there. But there's a limit. For each kidney, they really only think you can have about 2,500 shocks, I believe. So they give it their all until it's either blasted up or they've reached the maximum amount of shocks, and that's all you can do. The one thing they don't always tell people, which I warn people about, either large stones or stones that present with difficulty, sometimes if it doesn't blast up as well as they thought during the lithotripsy, they will actually go up through the urethra and the ureter, and they will put a stent, which is sort of a temporary bypass to make sure that your kidney doesn't get blocked off from fragments. And so some people thought everything, was going to be non-invasive, just around the side or the back, and they wake up with a string hanging out, get pretty concerned, but that can happen. The other thing is those uric acid stones I mentioned, which don't show up well on x-ray, they don't always show up either, even with the lithotripsy machine. So they can do their best sometimes of trying to do what's called a retrograde study, which is they shoot some dye up and get it to kind of surround the stone, but it's not as good as if you get a clear image. So there are some people, they tell them they're just not a good candidate for lithotripsy. The other thing is they say one procedure, depending on the stone type, they can maybe break up about 1 centimeter at a time. And some people have some huge golf ball stones, so you may have to go in multiple times. There's people who come out every 3 or 4 weeks are going in to get a little bit more and a little bit more cleared up. And it's expensive. They were charging like at least $10,000 a procedure, and that's just for the machine back when I was doing it. So it's costly.
If you have a stone that's a centimeter and you use this procedure, what would be normally expected as to how small pieces would be broken up into?
And that's a good question too, because it depends. There's some stones where as soon as they start blasting it, it literally starts to fragment and burst apart and look like particles of sand. There's other ones where you really, really blast it and it doesn't fragment very well. So it depends. But a good average, they give you a good at least 90% chance that they're going to get at least a centimeter per procedure. Not for everybody, but that's a good ballpark, and that's usually enough to get most people to pick something that's non-invasive. The other caveat for this, you cannot use this in pregnancy. A lot of people have asked, and delivering the shock waves will actually not only damage the fetus, but you're guaranteed to completely damage any developing ear bones. So you cannot do that.